Welcome everybody to our newish edition of Call the Doctor. By definition, we're inviting you to call in to us if you have any questions regarding tonight's topic. Jean and I would like to invite our special guest tonight, Dr. Brantley, Dr. Julian Brantley, who has been serving this community since 1993. He could say something that not too many doctors can say, and that he's a fourth-generation physician. That has served this area since 1889. That's very impressive. I don't know of another doc who says they have that heritage of service. So Dr. Brantley, why don't you tell us a little bit about yourself?
Well, I was born in Rocky Mount, and as you mentioned, my great-grandfather was born outside of Spring Hope, and actually became decided he wanted to become a doctor and went to Jefferson Medical School.
My alma mater.
In the early 1860s, where he was a good friend of a doctor named Dr. Julian Chisholm, who was the Surgeon General of the Confederacy. Anyway, my grandfather came back and he settled back in Nash County and began practicing in 1889. He named his first son after his friend, Dr. Julian Chisholm, and his son was named Julian Chisholm Brantley, and he then went to Jefferson Medical School and came back and joined his father in 1917, and they were basically horse and buggy, and then they evolved into the carriage of the early, automobile stage of country doctor medicine. And then my father went to Jefferson, and he practiced OB/GYN and came here in 1947. And then I graduated medical school and went into OB/GYN residency, worked in Little Washington, North Carolina, and then came back here.
Did you break the Jefferson tradition? Or
I did. I went to the University of North Carolina.
There you go. Well, I'll make up for
Very
it.
good.
Jefferson's my alma mater.
So, and then came back here in 1993 to practice OB/GYN, and did that until probably 2005, where we decided to stop obstetrics. I practiced gynecologic surgery and kind of subspecialized in robotic surgery, and then stopped that in 2018, and since then I've been doing this sort of double job that I've evolved into.
Right. Let me introduce that to people. So he wears two hats. He works at the Nash Wound Care Center, which we'll explain to everybody what that does, but it basically is kind of self-explanatory. If you have a wound that just won't heal for whatever reason, and we'll talk about the reasons why people have wounds that just won't heal no matter what you try, you need to seek a specialist to employ new technology, and sometimes even old technology, to stimulate the wound to heal so that you don't end up losing a body part. Or have an open wound for the rest of your life and the chance of getting a horrible infection and potentially even dying from that infection. The other hat that the doc wears is he works at the Carolina Family Health Center, and has done so since 2016. And we'll take some time in today's program to talk about that as well, how he helps promote the health of the less fortunate of our community.